The head and the face are the predominantly hairy regions of the body. In addition to these areas, hair is present under the armpits, chest, genital areas of both male and female patients. The outermost layer of skin on the head is called the scalp. Hair cells are embedded in the scalp, and each strand of hair keeps growing during the lifetime of an individual. Different types of bacteria are present on the scalp and the hair. If the hair is not kept clean, it tends to become matty, greasy, and can smell bad. This can spread to the scalp and lead to infections. You must ensure that the hair is kept clean and excess hair is periodically removed to avoid any discomfort to the patient. Let us look at the different methods of maintaining the hygiene of the hair of a patient. Common methods of hair care. Patients who can take a shower by themselves should be encouraged to wash their hair regularly. Shampoo is a special agent that can be used to clean the hair. You must motivate a patient to shampoo their hair regularly. In case of patients confined to the bed, you must shampoo the hair of the patient and keep the hair of the patient clean. Hair should be properly combed and locked from time to time. You should assist the patient in combing the hair and keeping it clean. In the case of male patients, facial hair in the form of a beard or a moustache has to be shaved and trimmed according to the patient's choice. Excess hair in other regions of the body, such as the armpits or the chest, has to be removed according to the directions of the doctor. Hair is removed by barbers. Barbers can provide hair cutting services in the hospital as and when requested. Assisting a patient with hair care. Arrange for all the required equipment by the side of the bed before you start cleaning the hair of the patient. The equipment needed include a large pitcher of warm water, shampoo, bed shampoo pan, towels and washcloth, clean comb and brush. Let us look at the procedure for hair care step by step. Untie the gown or loosen the bed clothing. Cover the pillow with a towel or any protective cover to keep it dry. Put a towel under the person's neck and arms. Put the bed shampoo pan under the person's head. Place a washcloth over the person's eyes so the shampoo does not burn them. Wet the hair of the patient first and then apply the shampoo. Wash the hair of the patient until it is clean and shiny. It takes more rinsing for a female patient. Hair should be shampooed 2 to 3 times a week as it becomes dirty or greasy soon. However, before washing the hair of the patient, check with the doctor if it is fine to use a shampoo. Gently dry the hair of the patient using a clean, dry towel. Now, help the patient comb the hair with a comb or a brush. Tips for maintaining hair hygiene. If the hair is wet, do not dry the hair fully with a hair dryer. Let it dry naturally if possible. Regular brushing and combing is necessary for the patient to feel comfortable and to look neat. Provide the patient with a brush, comb, and a mirror. Combing the hair prevents it from getting entangled. Use short tooth combs for short hair and large tooth combs for curly hair. To untangle hair, use a wide-toothed comb, starting from the ends. When all tangled ends have been removed, comb the hair from root to end. Parting allows for ease in brushing smaller sections of hair. First, part the hair into 2 sections and then separate each section into 2 more sections. Brushing helps to keep the hair clean and distributes the oil evenly along the hair shafts. But do not strain the hair strands by brushing too vigorously. Avoid tying or braiding your patient's hair too tightly. After use, wash the brush and comb in hot soapy water. If necessary, engage a local hairdresser in the care process.